Good evening, everyone. Thank you so much for joining our Wellness Essential webinar. Today, we're having a Q&A session with the Juice Doctor again. Thank you so much, Juice Doctor, for joining us this evening. Our goal today is to ask Juice Doctor a couple of questions. And the first question we're going to focus on is hay fever. Second question will be lung infection. And the third question will be what's the other one? I can't remember now. Oh, I'm gonna start again. Okay, the first question I'm gonna ask him is on hay fever. Second question is on asthma, and the third question is on lung infection. Those are the three questions I will be focusing on today. So if you do have any of those type questions, please put them on the chat, and I will ask him as we go along. Okay, just telling you some of the services that Gloria Edward Nutrition does. We do the bio scan, we do essential oils, massage and sleep oils, organic herbs and spices. We have skincare range, the hair care products. We do detox program as well, food intolerance scan. I do webinars or seminars for churches, for schools. And also if you want me to do it for your staff, that is also fine for us. We do meal plans, we do ready meals, we do cooking classes. We also do nutrition coaching, one-to-one coaching, as well as group coaching. And just recently, we've introduced the menopause coaching for group people that are going through menopause or past menopause and need information on how to improve their health. We're also doing that as well. We've got our pain clinic every Saturday from 2 to 7 p.m. And you can follow us on our social media page. We've got Chef Emmanuel's Kitchen. We've got Gloria Edward Organic, as well as Gloria Edward Nutrition. Thank you, Juice Doctor, for joining us this evening. For those of you that do not know Juice Doctor, he's a clinical nutritionist and natural health researcher. He's also a detox specialist, an innovator and a manufacturer of botanical healthcare products. He's a social entrepreneur. He's CEO and founder of Gorgeous, and as well as MI Healthcare Group. MI Healthcare Group provides natural health solutions, including personalized nutrition, lifestyle change program, and also integrated functional medicine approach. The Juice Doctor is very passionate about health, and he's also decided to empower people with knowledge to enable them to achieve optimal health that leads to freedom through well-being. He believes that putting your health in your hands is the best thing that anyone can do. He specializes in detoxification, lifestyle change, and also methods that will help you grow younger and younger every day. He's also been able to help people with chronic health issues, weight problems, as well as health issues in the past and also presently. Thank you, Juice Doctor, for joining us this evening, and welcome to the Wellness Series.
Thank you so much. It's a wonderful pleasure to be here once again. As I said, I always love coming into these arenas where we have people that are hungry for knowledge, hungry for information, and hungry for higher levels of health. That's what we specialize in doing, serving people to bring them to the next level of themselves. So yeah, I'm really excited about the questions we're going to be firing today. So when you're ready, fire away.
Thank you very much. If you would like to contact the Juice Doctor, his email address is aaronleaves@gmail.com. He's got an Instagram page, Vivo Nutrients. His other Instagram page is MI Healthcare Group, and the website is mihealthcaregroup.com and vivonutrient.com. If you would like to book an appointment to speak to him or to do a scan with him, you can contact him on 0207 157 0052. That is how you can contact him. I just wanted to say a few things before we talk about hay fever or ask questions about hay fever. Again, remember to put your questions in the chat. Hay fever, like we all know, is an allergic reaction to trees, pollens, and also the symptoms that go with that is sneezing, coughing, runny nose, blocked nose, itchy eyes, throat, mouth, dry throat, nose and mouth, and also ears will be affected. Some people will lose smell. They have pain around their temple or their forehead, and they'll also have headache or earache, as well as feeling tired. those are some of the symptoms of hay fever. In recent times, I've had the opportunity to scan a few people, and I noticed that people that were not having hay fever in the past are beginning to have hay fever. The weather has been very hot lately, so people are beginning to react and be allergic to pollen, to grass, and also to weeds. If you live in an area where there's a lot of trees, you're definitely going to be having hay fever. But for many people, because they take lemon and ginger and all those kind of things, it definitely suppresses it, but sometimes you feel sick and you don't know why. So the first question I'm going to ask the Juice Doctor this evening is, what exactly is hay fever?
Okay, so hay fever, in a nutshell, is it's an allergic reaction that leads to coughing, sneezing, congestion, and a runny nose, as well as sinus pain. It's most commonly caused by pollens or allergies to pollen, which affects about 1% of the population.
Thank you very much for that answer. So are hay fever similar to COVID symptoms? Are they similar or they're different?
The symptoms of hay fever are similar to the early stages of corona, but this is why it's important to get tested if you're experiencing any of these symptoms. Like if you have a high temperature, if you're having a fever, if you're having a persistent dry cough, shortness of breath, or chest pain. If you're experiencing any of those symptoms, it's advisable to to get yourself tested as quickly as possible. But the symptoms, they are quite close in the beginning, but then they do vary off into their own individual characteristics.
All right, I've spotlighted myself. So sorry about that. I need to unspotlight myself.
That's okay, because I think if you're spotlighted, oh no, you stay spotlighted. Oh, there you go.
No. So is hay fever contagious? Is this something that I can pass on to my son or to my husband?
Essentially, no, it's not contagious. It is an allergic reaction that occurs when the body, comes into contact with, things like pollen. But allergic reactions are not caused by viruses or bacteria, and they can also not be passed on to other people. However, if you are experiencing symptoms of hay fever, it is really advisable and recommended that you do stay away from others who may be susceptible to respiratory illnesses, such as coronavirus. So just to be on the safe side, it's better if you stay away from people, especially in the climate that we're in now. It's better to sort of isolate yourself if you can until you've got your symptoms under control.
Thank you again for answering that question. So can I develop hay fever later in life? I haven't had hay fever from young, and then I become 50 and I start having hay fever symptoms. Is that possible?
It's actually very possible. You can develop hay fever actually at any age. Although it's most common in children, it can affect people of all ages. So if you start experiencing, symptoms for the first time later in your life, this is a sign that you've been exposed to some additional pollutants. So that will be a good time to get yourself checked to find out if you have the pollen allergy, and so that way you can put the right intervention in place pretty much straight away.
Well, thank you again for answering that question. So what are some of the tips to avoiding hay fever?
The best way to avoid hay fever is to try and stay away from the allergens that trigger your symptoms. This might mean, avoiding going outside or doing outdoor activities that you love during the peak pollen periods. But it's a worthwhile sacrifice if you want to really have a good quality of life. Also, keeping your windows closed is another way to help keep out dust and pollen, and washing your hands regularly to help remove any allergens. If you have pets, keep them out of your bedroom, especially your bedroom, and then make sure you hoover regularly to reduce the amount of pet hair and dander that may be shedding in the house. You can also get some wraparound eyewear, those lovely glasses that cover the whole of your face and cover the whole of your eyes. They can also prevent pollen from getting into your eyes. Another good tip that you can use is actually putting Vaseline on your nose, on the tip of your nose. That helps to really trap any pollen and prevent it from entering into your system, where it can start to cause damage and harm.
Thank you again for that tip and for answering that question. Can hay fever cause asthma?
Can hay fever cause asthma? Yes, it can. If you have asthma and hay fever, it's important to take steps to control both of those conditions. And this obviously means you taking your medication, as often as you can. But the most important thing is to try and avoid your triggers and keep your asthma medication with you at all times, so that your hay fever doesn't start to be exacerbated and lead into asthma, because they are very closely related. So it's important that you control one condition so it doesn't migrate into the other.
Okay. I'm going to ask the question. Jackie's just asked the question on the chat. And why is it I suffer badly from hay fever in the UK, but when I travel to the Caribbean, it stops it instantly?
A lot of people experience this phenomenon. And the one thing I'm going to probably put it down to is the levels of pollution. When you come into the UK, there are quite high levels of pollution, as it, it's quite a built-up area. There's a lot of, industrial activity. There's a lot of, cars, a lot more cars. When you go to like, the Caribbean or Jamaica, it's a much smaller islands, and much less densely populated. And, there's a lot more greenery, a lot more shrubbery that can produce a lot more oxygen. So the air you're going to be breathing in the Caribbean is going to be a lot cleaner and have a lot less pollutants in there that will impact your immune system and cause you to have a reaction. But when you come back to the UK and you're faced with those high levels of pollutants and heavy metals and different irritants that are in the air, it's highly likely that your symptoms would return. So that's the main reason why you'd have it really severely when you're in the UK, but not have it when you go to the Caribbean.
Okay, thank you again for answering Jackie's question. Please continue to put your questions on the chat and we'll answer them as we go along. And my next question is, what are some of the common hay fever triggers?
The most common hay fever triggers are obviously pollen from trees, but you also got pollen from flowers. You've got pollen from grass or grasses. You also have pet hair and dander. And then you have dust mites, which are, available all round to trigger symptoms of hay fever in your house, in your car. Also smoke and moles. But if you know your triggers and you know what they are and where they are, then it's a lot easier for you to, take the steps to avoid them.
Thank you again for answering that question. Can hay fever cause itchy skin?
Hay fever in particular can cause things like hives, hive-like formations on the skin. The first symptom you'll notice is when you have like an itching and maybe some red patches or rashes on the skin. And these will look more like welts than bumps with, distinct edges. So yes, they can cause itchy skin, and they can cause a lot of rashes that you may or may not be aware of, or be aware that they're related to your hay fever.
Thank you again for answering that question. Somebody's just put a question on the chat, so I'm going to read it out. Are there any foods which make hay fever worse?
That's a very good question as well. Any food that puts a burden on your immune system is going to have an impact on your body's ability to manage the pollens and the allergens that trigger your hay fever. Any foods that are maybe overly spicy, foods that are processed, foods that are high in fat, anything that the body finds hard to digest and to process, these will take away from your immune system, which is trying its hardest to respond to almost this allergen that's actually not physically there, or specifically there. So when you're looking at your diet from a hay fever perspective, you want to be looking at doing the things that you can to support your immune system. So foods that are fresh, that are more close to their natural state, are going to be more beneficial. Things like fresh fruits, things like leafy greens. These are going to contain a lot of compounds that are going to help to support your immune system to overpower the effects of hay fever. So foods that you eat are going to have an impact, but more importantly is what you're not eating that's going to have a better impact on helping to improve your immune function and its response to your triggers.
Okay, thank you again for answering that question. So what's the difference between hay fever and a cold?
Well, the main difference between hay fever and a cold is that hay fever is an allergic reaction, while a cold is caused by a virus. Now, the hay fever symptoms, will include things like coughing, sneezing, congestion, runny nose, sinus pain, while cold symptoms will include things like a headache, body ache, sore throat, and nasal congestion. And on the whole, cold symptoms will usually last for about 7 days, and you'll shake it off, your immune system will get on top of it. But hay fever symptoms can last for weeks or even months, if not brought under control, sometimes even the whole year.
Thank you again for answering that question. So what treatment do you have in your company or your website that can help me if I had hay fever? Or what products?
We actually have a whole range of natural interventions that pretty much stop most of your hay fever symptoms dead in their tracks. We have a product called eye mist that uses silver to wash and soothe any itchy or dry eyes. It's very effective at washing out the eyes, even if people have other eye-related issues, such as cataracts, glaucoma, uveitis, styes on their eyes, anything that affects inflammation or causes inflammation in the eyes. The eye mist really helps to reduce that because it's got the antibacterial properties in the silver. Also, it contains zinc as well, which boosts your immune function. We have another product called the nasal stick, which uses essential oils to clear the sinuses. It stops your sneezing, it stops your itchy throat, it stops your eyes watering. In fact, it actually addresses around 80% of your hay fever symptoms. People really swear by the nasal stick because, again, it uses essential oils, which are plant extracts and are very powerful against the allergens. And obviously the fact that they boost the immune system as well, which has quite a profound impact on your body's response. Then we have a product called flu drops, which is a powerful combination using plant extracts of oregano, things like garlic, ginger, along with things like black seed oil, hemp seed oil. And these really help to, deeply cleanse the blood and strengthen your immune system at a cellular level. We also have Respirate, one of my favorite products. Respirate is another pure essential oil blend, which uses aromatherapy to help clear the lungs, to clear your sinuses, clear your respiratory system. And it helps to break down any mucus deposits that may have been building up that would contribute to restricting your airways and making effortless breathing a lot more accessible. And last but not least, in our arsenal, we have a product called Lung Flush. Now, Lung Flush really helps to boost the lung immune system because the lung has 3 different types of immune system. It has the innate immune system, it has the adaptive immune system, and it also has peptides, which pushes any pathogens that are stubborn and that have survived the first 2 immune responses to push them down into the stomach. But when you use the Lung Flush, it really helps to support those 3 immune systems by increasing the blood supply and, of course, the nutrient supply to support the lung function and the whole respiratory system as a whole. So those are like our 5, really hardcore respiratory-based products that have been really instrumental in really transforming people's lives, and more importantly, their summers when it comes to them battling against hay fever.
Thank you again for answering that question. And I think my last and final question for hay fever is, can hay fever cause me to vomit or nausea?
Hay fever causes a wide variety of symptoms, including sneezing, congestion, itchy eyes, and a runny nose. In some people, it can also lead to nausea and vomiting, but not with everybody. But this usually occurs when the allergen comes into contact with your stomach rather than your respiratory system. So this is what I was saying about the innate immune system, the adaptive immune system, and then your peptides. Your innate immune system is one immune system that you're born with. This will normally address any type of threat that comes into the body that gets past the tonsils or gets past the throat, or the adenoids, which is like your first outpost that stops from getting to the body. If it gets past the innate immune system, it's then going to have to deal with the adaptive immune system that adapts to different pathogens or different threats that come in different forms and different guises. And then the last stage is the peptides, which will push things down into your stomach. If they're stubborn enough to get that far, then it's highly likely that you could end up vomiting as a last resort to remove this particular stressor or pathogen or antigen from your body.
Cool. Thank you again for answering all my questions regarding hay fever. Just before I move on to the next set of questions, be reminded that you can put your questions on the chat. I just wanted to just go over some of the stuff I had on the slide. Yes, and these are all the products that the juice doctor was just mentioning: the nasal stick, the flu drops, the eye mist, and also the Respirate for the hay fever. So some of the foods that you need to avoid for hay fever are melons, bananas, and cucumbers. Those are the foods that you need to avoid. Foods that you need to eat are lots of onions, fish, flaxseed, omega-3, fatty acids, the oils. You can have some apples or broccoli and also turmeric. So the next set of questions, we are going to be talking about asthma. So the symptoms of asthma are frequently coughing, shortness of breath, feeling tired, wheezing, trouble while sleeping, chest pain, common cold, allergies, and also trouble sleeping. So some adults will have asthma, and some of the symptoms they would have include coughing, wheezing, difficulty breathing, chest pain or tightness in the chest, and also chest infection. So we're going to be asking the juice doctor questions about asthma. So if you have any questions, please put them on the chat and we will answer them as we go along. So the first question I want to ask you, juice doctor, is what is asthma?
Asthma is an inflammatory, very common long-term lung condition that affects the airways, that carries air in and out of your lungs. In the UK alone, there's about 5.4 million people who are suffering with asthma, which is about 1 in every 12 adults or 1 in every 11 children. So there's a lot of people who are suffering with asthma, this very, 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 very common inflammatory condition. But people with asthma often have sensitive inflamed airways that can develop into symptoms like coughing, into things like wheezing, as you mentioned earlier, feeling breathless or having a tight chest.
Thank you very much. So why do people get asthma then?
It often starts in childhood, but adults can also develop asthma as well. But some things that make asthma more likely to occur could be things like having a history in your family of allergies or respiratory ailments or conditions. But the real thing that you need to understand is that asthma has 2 identical twin cousins. They're called eczema and allergies. Eczema, asthma, and allergies, sometimes they happen or they occur simultaneously at the same time. Doctors, they don't understand how this happens and they call it the atopic trial. It's almost most common in babies and young children, but there's also a risk factor for them developing asthma and allergies later on. Because as I said, they're effectively 3 sides of the same coin. Now, all 3 conditions, they all cause inflammation, which, may help explain the link, between eczema and allergies, but they happen effectively when the immune system secretes inflammatory chemicals. In the case where it's allergies, the immune system will overreact to what we call harmless substances or things it can't see, while eczema may cause a person's body to actually attack itself, to attack healthy cells. Now, science and doctors, they don't fully understand the atopic triad or the tendency for eczema to develop into allergies or asthma, but the presence of the condition in the triad is a clear risk factor for each other, which may help people with symptoms and their caregivers or whoever's looking after them to identify or which may be the best route or the best relevant treatment to support their prospective outcome. But the 3 of them are all related. Most people don't realize that if you have asthma, when your immune system is responding to the asthma, you may well break out in eczema. And the same thing happens in reverse. If you have eczema, your immune system, when it's responding to the eczema, it may well result in you experiencing asthma. So they're both linked, inextricably linked. So it's good for you to know that and be aware that if you do have eczema, look into the possibility of your child, especially if you have a lot of children who are being presented with eczema, look into the possibility of your children also having some kind of respiratory ailment or disorder.
Thank you so much. Batu is asking, does stress cause asthma?
It can have an impact, most definitely, yes, because when your stress hormones become triggered, that can also trigger an inflammatory response, which will have an impact on the lungs, because sometimes you get short of breath when you may be hyperventilating, you're responding to a very highly stressful situation, your body starts to gasp for air because you have a greater demand for oxygen. It pushes all your hormone levels, your adrenal levels get pushed into overdrive. So yes, if you remain in that heightened state of anxiety and stress, then yes, you could actually trigger the development or the onset of late stage or late life asthma.
Thank you once again for answering the question. Please keep your questions coming. We will answer them as we go along. So what are the triggers, the things that trigger asthma symptoms?
There are a lot of different triggers. There are a lot of different things that can make asthma happen or actually make them worse, but not everyone will be affected by the same things. Things that set off asthma symptoms are, obviously, as you mentioned, they're called triggers, but finding out what sets off your symptoms, is what's important for your individual situation or your loved one's individual situation, because it could be a cold, it could be viruses, it could be pets, it could be pollen, it could be pollution, it could be house dust or dust mites in your bed, or even stress, as you mentioned, the question I think Batu mentioned earlier. Yes, stress could also be a trigger for asthma, which means you can work out different ways of avoiding your particular triggers. Once you're aware of what they are, then you can then take steps to avoid them at best. There's also certain stages in your life that might affect your asthma more. For example, some women find that hormonal changes, either during puberty or during pregnancy, or even during menopause, can affect their onset of asthma. So there are a lot of different things to consider when it comes to looking at the triggers. The best way actually to cope with the triggers is to always to use, if you have a preventer or any kind of preventive medicine which has been prescribed, use them effectively and use them well. Even when you're feeling well, use them. And if you notice that your symptoms are getting worse, then of course, we always recommend that you contact your GP or your asthma specialist.
Thank you very much for answering that question again. Does asthma get worse over time?
If you have, well, I guess if you haven't used your preventive medicine effectively, and then you have a lot of asthma attacks over time, it can make your asthma get worse because they can actually cause scarring in your airways, which makes them narrower. And this is sometimes called airway remodeling, where your lungs actually become tighter and they start to constrict. But if your airways are scarred and narrow, then you're more likely to have a worse attack and you're more likely to have symptoms more often. The best way to stop your asthma getting worse over time is to, adopt maybe a plant-based diet, incorporating more leafy greens, like, things like bok choy, things like spinach, things like kale, which are all rich sources of, carotenoids. They're all rich sources of iron. They're rich in potassium, calcium, and vitamins that are, and nutrients that have an anti-inflammatory and antioxidant effect. These can also reduce the levels of lung inflammation, and also they're just good for your health all around anyway. But try to also, incorporate these foods into your diet if you want to prevent, if you do have asthma, if you don't have asthma and you want to keep your lungs healthy, incorporate these kind of foods, incorporate more fresh foods, have things like beets, things like, beet greens, root greens, beetroot plant. Beetroot's very good because it has a lot of compounds that will optimize the lung function. Peppers are also very good, apples, pumpkin, turmeric. I'm sure everybody uses turmeric, blueberries. And one good thing we always recommend that's very good for boosting your lung health, even if you don't have asthma, is green tea, because it contains a lot of tannins and they really help to reduce the inflammation in the lungs and help to support your overall lung health as a whole. And then lastly, if you're a smoker, try and get help to stop you from smoking, get help to, to support you quitting, because giving up smoking will cut your risk of frequent asthma attacks pretty much by half, and it will prevent it from getting worse. So if you do see your symptoms are getting worse, once again, we always recommend that you contact your asthma specialist so they can review your treatment program and provide or prescribe the relevant way forward.
Thank you once again for answering that question. Can I die from an asthma attack?
Unfortunately, the answer is yes. Tragically, I think there's about 4 people that die every day from asthma attacks. In fact, there was a study done into asthma deaths. I think it was in 2014, and they looked at patient data from hospitals and GP practices across the country, and they found that 2/3 of asthma deaths were actually preventable. So a lot of these deaths were as a result of people not knowing how to deal with or to treat their asthma effectively, and they end up obviously having the ultimate, adverse demise, which was that they died as a result of their lack of knowledge. So, we really encourage people to come to talks like this, and I'm really happy and grateful that you've invited me to come and share this type of information, so we can really empower people with the knowledge and the tools that they need to help manage their respiratory system, their respiratory conditions, and ultimately to improve their health across the board. But yes, a lot of people do die from asthma. It is a very serious condition and something that really needs to be looked at and taken very seriously.
Thank you once again for answering that question. Does asthma sometimes go away on its own?
It's a lifelong condition, predominantly. Although some people who have asthma will always have asthma, but some people can be symptom-free with the right information, as we said, having a good diet and, you know, adopting the right lifestyle change or putting the right lifestyle changes in place. If you've been diagnosed with asthma as a child, your asthma may well improve or disappear. So it can actually go away on its own completely as you get older, particularly if the asthma was a milder version. But even though some children do have asthma at a younger age, they can actually grow out of it. And some of them can actually come back later in life. So, you know, it could be something that is just triggered by maybe something that's happened at work or a level of exposure to pollution, or as, you know, Jackie said earlier, when they've traveled to another country, they've been, you know, exposed to high levels of allergens that would have triggered an asthmatic reaction. But again, you know, we always stress the importance of making sure you adopt the right type of diet, get the right type of information, so you can put the right type of foods into your body to ensure you can reverse or remedy any adverse situation in your body naturally.
Thank you again. And the last and final question, is there any cure for asthma?
There is no cure, per se, inverted commas, from a medical perspective, but there are tried and tested methods and natural plant-based remedies that have had a proven record and have been very effective at actually reversing asthma. There are certain tree barks, and some people may have heard of them or not heard of them, but there are certain tree barks that contain compounds that have, you know, been proven even clinically that they are more than a match for even the most aggressive asthma. So this means that people who have asthma, or most people who have asthma, even if they're sticking to their prescribed medication or have access to a good naturopathic doctor, someone who's skilled in respiratory conditions, they can effectively get on with their lives and actually live a symptom-free life, not having to worry about asthma. But yes, medically, they'll say there is no cure, but naturally, obviously, nature has a cure for every situation. And that's what we advocate.
Thank you again for answering that question. I've got a question from Grace. I've heard that plugged-in air refreshers or sprays in the home can be a contributor to asthma and breathing problems. Is that true?
Yes, because they contain a lot of chemicals that may be irritant to the lungs. So when you plug those plug-in air fresheners, you've got to be mindful of what you're actually pushing out into the air, and especially the chemicals. Some of these chemicals are quite harmful chemicals, and because you breathe them in, they're going directly into your lungs. So they're not only having access to an already compromised lung situation, but it can actually make a bad situation worse. So yes, you're absolutely right, 100%, that those plug-in air fresheners could also serve as quite powerful triggers. So that's a very good question or suggestion, Pat or Grace. Thank you so much for asking that.
Thank you once again, Juice Doctor. I'm just going to quickly go over the slides, just to go over some of the points that we've talked about. The Juice Doctor has told us about the symptoms and how we can cure it and how it leads to death. Some of the other common triggers are allergies, pollution, pollen, stress, as well as dust. The foods that you can eat to help with your asthma: avocado, you can have ginger, kale, turmeric, rosemary, garlic, mustard green, chia seeds, tomatoes, you can have kelp, you can have, as well as spinach. But there are some foods that you definitely need to avoid. If you've got asthma, you need to avoid white bread, you need to avoid cookies, you need to avoid cereal, you need to avoid pizza, cured meats like sausages, you know, pepperoni, spicy foods you need to avoid if you've got asthma. You need to avoid drinking milk, you know, your favorite McDonald's burger, you need to avoid that as well. You need to avoid chips and also beef, as well as onion rings if you have asthma. These are some of the suggestions that we're trying to put across to you today. Hopefully, if you know someone that has it, tell them not to eat these foods. It will really help them, especially now when the season is very hot. Okay. Thank you. We're going to go into the final section of the question and answers this evening, and we are going to be asking the first question, and that is, what exercise is good for shortness of breath? So if I am constantly having shortness of breath, what exercise can I do to help me?
Anything that really strengthens your muscles. So things like stretching, walking, weight training can also be good for shortness of breath, you know, but just doing any kind of activity that strengthens the body and strengthens or increases the capacity of your muscles. So any good exercise regime, but make sure you check in with your GP before you embark on any such regime.
Cool. Thank you again for answering that question. So what's the fastest way to increase my lung capacity?
There's a thing called a technique called belly breathing, or which people can engage in, which really helps to increase the lung capacity, breathing deep from your stomach, and also deep breathing exercises that may help to increase the lung capacity. But anything to do with, holding large amounts of air and holding them for an extended period of time, these all, serve to really support increasing your lung capacity.
Thank you once again. Can I train my lungs to be stronger?
Absolutely. The more exercise that you subject your body to is the more work you put your lungs to, because the more you're working your lungs is the more you're working your heart, which is the more you're going to increase the capacity of the heart and the lungs to work together to get enough oxygen around your body, and also to get enough carbon dioxide out of your body. Because when you're working, you're doing a lot of respiration, which means you're producing a lot of carbon dioxide that needs to be expelled from the body relatively quickly. So the more you exercise is the more you increase the capacity and the strength of your muscles, which your heart is also one, and also your lungs, as well as your bones as well. So there's benefits all round to exercising. But if you want to get your lungs to be stronger, then having a regular exercise regime is always going to be key.
So in terms of the exercise, how many minutes exercise should I do? 30, 1 hour, 3 times a week?
Generally, for good health, the British Heart Foundation recommends doing at least 30 minutes of, slightly high impact exercise or activity. It doesn't have to be in a gym. It could be walking. It could be going up and down the stairs in your house. But 30 minutes just to raise the heart rate a little bit each day is sufficient to keep your body, your lungs and your heart in relatively good health.
So will skipping help?
Skipping is a very good exercise, but again, make sure that your knees can withstand the impact of hopping and skipping along, and that you have the right shoes, because you need to make sure you've got a good amount of spring so you don't cause any damage to your ankles. But skipping is a very good exercise, something that I'd be recommending you build up to very slowly.
Thank you again for answering the question. Next question is, what are chronic lung infections? So what infections can affect my lungs that will cause issues?
Lung infections are very common, and they're generally caused by viruses, also bacteria, and also some fungal organisms. Chronic lung infections or pulmonary infections, they mainly affect the lower respiratory tract and can also be very debilitating. We are seeing quite a lot of cases of people who are presenting with lung infections, and they are often as a result of having a high fungal level in the body, which starts in the gut, then it enters into the lungs, and then it starts to spread, and eventually it starts to colonize through the spores. It starts to colonize the lung, which then leads to a lot of further problems. So when you're dealing with lung problems, we find we're often having to deal with a lot of fungal issues as a result of overgrowth. Sometimes that stems from leaky gut, but essentially it's the base of it, the foundation of it is fungus that's actually wrecking and destroying the lung.
Okay, just a quick question. This is not part of the questions I planned. Does COVID have anything to do with lung infection or damage into the lungs?
Yes, absolutely. COVID has a very strong impact on the lungs, because it's a respiratory disease, it's a respiratory condition. So the more you have your immune system low, and the more you have your diet not brought into check, is the more vulnerable you're going to leave yourself and more exposed you're going to be to COVID or COVID-related infections. So we always advise people to be proactive and preventive more than reactive. So that way, the chances of them contracting any kind of respiratory condition, including COVID, are greatly reduced. So looking at your diet, looking at what you're eating, we all know what time we're living. We all know what's happening in the environment. We've all seen what's happening with the pollution. We've all seen what's happening with the air and the quality of air. So that having that as a backdrop, it should always prompt you to take more precautions regarding how you manage or improve the quality of the health of your lungs.
Okay, would you say that people that have had COVID more than twice have problems with their lungs as a result of having COVID?
Yeah, they would have sustained extra damage, but how we approach people that have long-term lung issues is not so much targeting the lung itself, but going a little bit further down into the gut. The reason why we go and target the gut is because over 80% of the immune system is actually in the gut. And all your immune responses to any kind of lung threat or lung infection is going to be coordinated and directed from your gut. So the less burden you have on the immune cells situated in the gut is the more able and available they are to go and attack and deal with situations further up the line. There've actually been some studies that have shown that some of the viruses related to COVID have actually been seen to multiply in the stomach. So, and also in the same way, there's been a lot of damage to the stomach, and there have been like surges in searches for symptoms related to stomach disorders when people have had fears of having COVID or being actually infected with COVID. So there's a lot of data that's supporting the targeting of the gut in as a means of addressing what's happening a little bit further up in the lung. In addition to that, your gut is where you have a lot of your parasites, and a lot of parasites, they multiply in the gut because they feed on your diet, they feed off your food. And if you notice, most of the effective COVID per se interventions, they are actually antiparasitic. Things like hydroxychloroquine, it's an antiparasitic drug. It's actually made predominantly from wormwood. And wormwood, again, the name gives away what it does. It deals with worms. It clears worms out of the body. So there's a lot of information that's really helping to people to make more informed decisions about how they approach the lungs and approach the health of the lungs in relation to COVID, especially from the gut perspective, in terms of supporting your gut, making sure you've got the proper use of probiotics to make sure you've got the right levels of bacteria, because bacteria really help to support your immune system. They really help to regulate and modulate your immune system's response when it's under any particular types of threats. So the more information, the more knowledge you can have regarding the role of the gut in strengthening and supporting your body's response to any kind of lung activity, is the better prepared you'll be to prevent these type of situations from manifesting or affecting you in the future.
Thank you again for answering that question. I've got another question from Grace. She says, is this true that the use of body deodorant, sprays and perfume can affect my lungs or my breathing?
Absolutely. As you spray them, you're just spraying a whole lot of chemicals that are being ingested directly into your lungs. They're going to go into your upper respiratory system and they're going to settle there. And when they go in, your innate immune system, which is the first immune system that's going to engage them, is not going to know how to deal with these, because it's going to be overloaded or bombarded with these strange and foreign chemicals that it's probably never come across before. Then you're going to have your adaptive immune system, which then has to put a tag on these chemicals and try its best to try and break them down and to try and reduce the level of damage they may exert on an already probably flaying lung. So yes, these deodorants and these antiperspirants that you spray have a phenomenal effect on the quality and health of your lungs. And more importantly, when they do get absorbed into the lung, they tend to embed themselves into your lung tissue and continue causing damage for a considerable period of time. We tend to see a lot of clients that come and they have their scan, and when we do their scan, we discover they have high levels of chemicals in their lungs. We've seen a lot of people with steroids in their lungs. We've seen a lot of people with things like even marijuana or cocaine in their lungs. And how they ask, how are these getting there? They say, we don't smoke, we don't drink, we don't do drugs. But because sometimes their neighbor may be using drugs or using marijuana or using, cocaine or whatever drug is in their system, this through secondhand smoke will then end up in the lung, and then the lung has a challenge or has some level of difficulty trying to expel these chemicals or the byproducts of these chemicals from the lung. So it ends up having to embed it in there almost as a means of trying to isolate it. So we do see a lot of cases of things that people have inhaled from the air which is from outside or from an external source, which is still embedded and showing up in the lungs and in the respiratory system and causing some level of problems. So that's when it's coming from an external source. When you look at things like your respiratory, your deodorants and your antiperspirants, these are in a very close proximity because you're spraying them under your armpit, which is very close to the lung because it's going to go in through your skin. So you're also going to inhale it through your mouth as well. So these are going to have quite a significant impact on the quality and health of your lungs. So it's really important for people to recognize that everything around you has an impact on what's happening inside you. So it's really important that you really are more proactive about ensuring you keep the health of your insides just as robustly as you do your external health.
Thank you again for answering that question. And thank you, Grace, for all your questions. They've been really useful tonight. Next question, what are the causes of chronic lung infection?
Chronic or I guess even recurrent chest infections can occur in one of, I guess, the following circumstances. If, number one, your body is too weak to fight off infection, for example, from an antibody deficiency, if you haven't got enough antibodies, your body's going to be more susceptible to developing a chronic lung infection. If there's any structural damage, if you've got any kind of inflammation, any kind of bronchitis, that's also going to have leave you more vulnerable and have an impact on your body's ability to fight off any kind of chronic lung infection. Also, if you've got an infection that's caused by a difficult organism, such as the Pseudomonas bacteria or the Mycobacterium, Aspergillus fungus, if you have these type of fungus which are colonizing your lung, these are going to leave you very susceptible. And these are the things that we're seeing more and more on a daily basis, where people are coming in with with fungus-related lung infections that they're trying to address from a respiratory perspective, but they're not looking at the impact of the fungus or the impact of that the gut is actually having on the health of the lung. So we always look at it from a perspective of, if you had a dustbin in your house and you never emptied that dustbin, especially with the intense heat that we're experiencing of late, that bin will start to produce bacteria and the food will start to rot, and then you'll start to see maybe maggots. Even if you don't see maggots, you're going to start to experience a very foul and pungent smell. When that pungent smell, if the bin's not emptied for maybe 2 or 3 days and the heat continues at the level of intensity, that bin is going to start to produce gases and toxic smells that are going to be really intoxicating the whole of the kitchen. Then it will start to move out into the hallway, then up into the passage or up the stairs. The same thing will happen in your body. If you have bowels that aren't excreting your waste efficiently, that food that is undigested or is not expelled or eliminated correctly, that food will continue fermenting in that very warm and moist environment inside your gut, albeit acidic. But if it's not digesting and it's not being broken down, it's not being eliminated, it's going to start to produce toxic gases that, guess where they're going to go? Straight up into your lung. Remember we said earlier about doing belly exercises to increase the lung capacity. So you know that whatever is in your stomach can very easily come up into your lung. And as we know, sometimes when people have bad breath, it's as a result of what's happening further down inside the gut. So these are all some of the things that will have an impact on the development or the onset of chronic lung infections, but recognizing again that we're going back to the gut and then to the colon and make sure that we can make sure we have a good flow of waste exiting the body so that we can prevent the buildup of bacteria and especially fungus from moving further up and colonizing the lung.
Thank you again for answering the question. Tanisha says, what causes granuloma in lungs and how can I remove them?
Well, when you have any kind of bowel problem, again, this is where you have some kind of blockage. And as I said, the waste is not being eliminated from your body. Toxins will then start to build up in your gut, and then they'll start to escape out the gut and start to get into the bloodstream. When they start to get into the bloodstream, these cells will now become contaminated. And instead of you bringing nutrient-rich cells to the lungs, you're going to bring toxic-filled cells and contaminated cells, which are going to, bring contaminated gases and contaminated different toxins to that area. As they start to accumulate in any area of weakness, that's when you're going to start to develop growths, or growths will start to develop because you've got a weak area where you haven't got a lot of defenses or a lot of immune cells that are able to congregate in the area because of the lack of available nutrients, to the body or to the cells, that's when you're going to start seeing, granulomas and growth starting to develop. These are all going to stem from the state of your diet, also the levels of hydration that you observe, because as you drink water, you increase your body's ability to flush out a lot of these toxins through the kidneys. So if you're not drinking the right amount of water, or you're not eating the right levels of fiber, these are all going to have an impact on the body's ability to remove these toxins and prevent them from accumulating and causing damage within your tissues and within your supporting organs.
Thank you. And last and final question tonight. Thank you very much, everyone, for your contributions and your questions. What are the symptoms of chronic lung infection?
The most common symptom of chronic lung infection is having a persistent cough. The person who's experiencing this will probably often bring up phlegm or mucus when they're coughing. And in some severe cases, they may also bring up blood. Some patients with recurring chest infections also experience some night sweats or fever. They also may experience a feeling of tightness across the chest, or sometimes a sharp stabbing pain, like a pleurisy. They may also experience shortness of breath, which may involve wheezing. And lastly, because they haven't got enough oxygen coming into the body because of the tightness or the constriction, they may also experience fatigue, where they'll start to feel tired because they're really working hard to try and breathe and trying to get enough oxygen into the body, especially as a lot of COVID patients are experiencing a level of weakness and tiredness within the body. The symptoms they'll differ and vary, and the level of severity will vary from person to person, but they can all be addressed once you understand what's actually happening in the body and what the underlying causes, or what the underlying situation or the underlying issues that have contributed to this situation in the first place, and you start to address those, then you have a good chance of reversing that level of chronic infection. In fact, I had a client that was seeing a doctor. They was actually being seen by a GP practice not too far from where we are. And they had about 4 or 5 different doctors and specialists from the hospital trying to control their particular infection. In fact, the infection was so bad, they had lost, I think, 60% or 70% of their lung function. And the doctors were recommending that they had a lung transplant. So because I have a good relationship with the doctor, they said they hadn't got anything else they can do. There's nothing else they can do. The woman was adamant she didn't want to have a lung transplant. So the doctor actually, allowed her to come. He didn't recommend her, but almost recommended her to come and see us. So she came and saw us. We put her on a scan and we looked at her body as a whole. And we identified that there were a lot of pathogens and toxins that had been accumulated in the gut. But one of the things that really brought her to our attention is that while the doctors were seeing her, and some of them were naturopathic doctors as well, while they were seeing her, they used some of our products for their patients. They had been using our Respirate lung support, which is like an essential oil blend that has got all the top oils that are really powerful at really addressing respiratory type conditions. And she'd been using that for a number of months. And what she said is what really confounded all of them, because she said she was coughing so loudly during the night that it was waking up her neighborhood, and nothing they were giving her, no level of medication they were giving her was able to reduce that cough, reduce levels of infection, and to reduce the intensity of the cough that she started to vomit as a result of her coughing. But she said when she used the respiratory lung blend, or the Respirate lung blend, she said that was the only thing that was able to bring her lungs into order and to stop her from coughing all night and waking up her neighborhood. So she was quite happy when she was allowed to come and see us, and for us to take her on as a client. We took her on as a client. We did a scan. We identified all the stresses that were affecting the body and affecting the immune system. We focused particularly on the gut. We saw there was a lot of abnormalities within the gut. There was a lot of imbalances within the gut, and we started to clear up her gut. We started to focus on detoxification, cleansing the gut, nourishing the blood, cleansing the liver, and just really supporting all her natural bodily systems to do what they're naturally designed to do, but more effectively. And she went on a program, our lifestyle change program, for a period of about 8 weeks. She finished the program. We did a review. Her lungs were much more calm. There was not so much infection. She was hardly coughing. She used to have a machine that she had to use. She stopped using that machine after about 12 weeks. Lo and behold, after about 6 months after she finished the program, she came like what we call like an outpatient on maintenance. After 6 months, she went back to her doctors and back to the specialists at the hospital. And they then, two things happened. Number one, they saw that her lung had regenerated. So her oxygen capacity had increased. Lungs that were at 30% or 70% had been damaged had now increased to between 35 and 40%. So her lung capacity, her lung function had increased. And the second thing was that they were no longer recommended, and she no longer wanted, she didn't want anyway, but if it's a last resort, she might consider it. But she no longer had to have the lung transplant that they were recommending for her. And we were able to achieve this purely through diet, detoxification, lifestyle change, and getting the right nutrition into the body. So this goes to show that, you know, these chronic lung conditions can be reversed, and if not reversed, they can at least be managed by using the right interventions, having the right approach, having the right information, and having the right dietary changes and guidance to make sure you can implement those to a way that they'll have greatest effect. So yes, chronic lung infections, they are very rife and they are very debilitating, but there are a lot of things that can be done to help to relieve some of these symptoms and to bring some of these situations into order.
Thank you so much, Juice Doctor, for joining us tonight. And we appreciate you. And thank you, everyone, for joining us. I'll just quickly go over the last points before we wrap up. So some of the products that are on the screen are some of the products that the Juice Doctor is mentioning. You want to tell us a little bit about the oxygen and the uplift?
Okay, what I'll quickly start with, as I said, I've been really harping about the importance of the gut. I'll start with the Oxyflush, because they call it King Oxy, because Oxyflush is king, because Oxyflush really helps to clear out the gut, clear out the colon, and clear the pathogens and change that environment to make it more conducive to accelerated healing. So Oxyflush is a very, very powerful tool in your arsenal to make sure you can clear your colon. It gets rid of a lot of the bacteria and just really changes that environment and really supports your immune system to ramp up its activity to be more effective in other parts of the body. Then moving from right to left, we have the Respirate. That's the Respirate I just mentioned, the Respirate lung support. Very, very powerful product. We've seen it used very effectively and extensively during COVID. A lot of nurses were using it. They were putting like a drop in their mask, and as they were breathing it in, it was going into the lungs. It was stopping them from having any of the symptoms that a lot of their colleagues were experiencing. It's very good for clearing any mucus in your nose. It also gets into the limbic system in the brain, because you put a few dots in your hand, rub your hands together, and just inhale. It has such benefits for the whole body, but anything from the brain going right down into the lungs, the upper and the lower respiratory system. And then when you diffuse it overnight, again, it has great implications for people that are experiencing or suffering with asthma. So there's so many areas that it's been able to help and affect quite positively. Then we have in the middle, we have Uplift, which is another very powerful spray. These are all essential oils, by the way, but the Uplift is a very concentrated essential oil blend. You only need to spray one burst above your head. You know, it creates almost like a mist around you, and it just almost like sanitizes your whole space and really helps to remove and destroy a lot of the harmful bacteria that may be lingering in the air, to make sure you've got your own, almost like your own little health bubble created around you. And then you've got the lung flush. Is that lung flush? Yes. Liquid oxygen, sorry, liquid oxygen. Liquid oxygen is the second to last one from the left. Liquid oxygen is a very, very powerful product. People have been using that all over the world, and they've always come back and given really powerful testimonies of how they've used the liquid oxygen, and it's really helped to increase their breathing. It's helped to increase their oxygen capacity. It's helped to remove or take them out of that place of hypoxia. Hypoxic is basically, or hypoxia is when you have low blood oxygen levels. And a lot of people that are in COVID, they've all been seen to have or be suffering with hypoxia, which is low blood oxygen. But using the liquid oxygen has really helped them to increase their levels of oxygen within their blood. And obviously we breathe oxygen every day, so it's something that's very, very important to our day-to-day existence. And then last but not least, we have the lung flush. Lung flush is one of our pet products, because it's just so warm, close to our heart, because we've seen it really have some positive impacts on people with some really severe conditions. As I said, it really helps to pull all the nutrients and additional blood supply into the lungs. It has a lot of things like mullein, it has things like plantain. These are all really powerful plants that have an affinity, a particular affinity for the lungs. So when people have used the lung flush, they've really reported a great level of ease because the tightness in their chest has eased up. They've always had a lot of respite from any kind of mucus buildup in their lungs. They take it in the daytime, they take it at night, they take it with water, and it really helps them to sleep a lot deeper. And there's just been so many positive anecdotal testimonials from the use of lung flush that it's become a product that we really cherish and love when people take it and they go away. We just wait expectantly for them to come back and tell us the wonderful experience they've had with it. So these are 5 products that we find have a good affinity for the lung. They're very effective when they're used individually, or more importantly, when they're used collectively. And using them as a combination has proved time and time again to be very instrumental in the impact or in the transformation from when people had really bad lung conditions or even pneumonia, and in taking them from that really sick and debilitated state into a state of order and balance. So these are all available on our website, vivonutrients.com, vivonutrients.com, or MI Healthcare Group, www.mihealthcaregroup.com.
Thank you once again, Juice Doctor, for joining us this evening and for answering all our questions. Please be reminded that we're here again next week. But next week, we are bringing a GP to actually talk to us about nano products and all the other stuff. Please come ready to ask them lots and lots of questions about any sicknesses or diseases that you have, and they'll be ready to answer them for you. If you would like to contact me, my details are gloryedward21@gmail.com. My Instagram handle is Glory Edward Nutrition, Glory Edward Organic, and also Chef Imani's Kitchen. And my website is gloryedwardorganic.com. And also, if you'd like to book an appointment or speak to me or ask me any questions, the number to call is 0798-455-1292. Thank you so much once again for joining us, and we'll see you again next week at the same time, 8 o'clock. God bless you. Have a wonderful evening, everyone.
Thank you so much. It's really been a pleasure.
Thank you, Doctor.
Thank you.
Thank you.
Thank you,
Thank
guys.
you, guys.
Good information.
Thank you.